At the moment, there is no vaccine and no treatment for COVID-19. I'm Dr. Leana Wen. I'm an emergency physician and public health professor at George Washington University in Washington, D.C. Yes, it is. There are many ways that we should not even be comparing COVID-19 to the flu. Unlike the flu, COVID-19 is new. That means that no one has immunity to it, so it could spread very quickly. There is no vaccine and no treatment. COVID-19 has a higher fatality rate than the flu. The flu has a fatality rate of about 0.1%. COVID-19, the fatality rate is 1 to 3%, which is 10 to 30 times higher than the flu. This does not appear to be a pathogen that's transmitted through the fecal-oral route, meaning that if somebody is preparing your food and they're sick, it's unlikely that you will get sick yourself. But it can be transmitted through hard surfaces, also called fomites. So hard, non-porous surfaces like a tabletop, countertop, elevator button, a doorknob, the virus could live on those surfaces for hours to days. Soft, porous surfaces like hair or fabric, it could live on those surfaces for a lesser period of time. This is why, though, we recommend for everyone to be wiping down surfaces frequently, but most importantly, to wash your hands. Because it's not practical to avoid touching everything, but it is practical to touch using your hands and then wash your hands before you then touch your face. COVID-19 is transmitted through respiratory droplets. That's different from diseases that are airborne, like tuberculosis. But that said, there is new information and new research being done about this every day, and it's important that you keep up to date with the information through the Centers for Disease Control and Prevention website at cdc.gov or the World Health Organization website. In theory, yes, viruses can mutate. COVID-19 is part of a family of viruses called the coronaviruses, and other coronaviruses have a lower potential for mutation than influenza and some other viruses. So this is something that remains to be seen, but research is being done every day on this novel virus. At the moment, there is no vaccine and no treatment for COVID-19. COVID-19 is a virus, and there are antiviral medications. No, not antibacterials, because antibacterials kill bacteria, antivirals kill viruses. One hopes that there will be both a vaccine and treatment developed for COVID-19, although we do not have that yet. People can and do recover from COVID-19. Again, 80% of patients have mild symptoms and do not need hospital care, and these patients will recover with what we call symptomatic treatment, which is rest, fluids, over-the-counter medications, and people will recover without incident. About 15% require some type of hospital care or more intensive care, and then 5% require very acute care services, including being in an ICU or being on a respirator. I am concerned about those who are elderly, those who have underlying medical conditions, because they are more likely to have severe symptoms and end up in hospitals. And I'm very concerned about what happens when many patients get ill at once, because that could overwhelm our healthcare system. However, we are not powerless against this virus. There is something that each of us can do today in order to reduce our own risk of getting the virus and transmitting it to others. We will get through this, just as we've gotten through many other illnesses and pandemics and outbreaks before.